Now, back to Coastal Living on KZTV.
Hey guys, we are back with Dr. Kate Rodriguez, our mental health expert, and we're addressing suicide ideation to raise awareness on behalf of Suicide Prevention Awareness Day. Now we know that suicide is pretty common, but you were sharing some stats with me during the break. Tell me about that.
Yeah, so it's the 10th leading cause of death in the United States, but it's the number 2 leading cause of death in ages 14 to 24.
Which is like a really scary number.
Yes.
And you mentioned how many people have, out of how many attempts are they successful in doing so?
For every successful suicide,
there's no successful suicide. We're saying somebody who follows through with it actually loses their life.
There's 25 people who have attempted.
Yeah. Which is so unfortunate because I know, and I've witnessed it, and I know people who have gone through this, and I myself struggled with those thoughts as a teenager, and my life has been amazing, but it's just, you're so confused, and you don't know what you identify with, and who you really are, and why don't you fit in, and why don't I, fit into this group, and we're talking about that too. You said the LGBTQ community is one of the big demographics for that.
Yeah, so if somebody is struggling with their feelings of not feeling belonged in their family, so if a youth is in a family who does not accept their sexual identity, their chances go up eight times more than the other kids in their age group. Yeah. And so just feeling belonged in their family, feeling like you're listened to. Like you said, you struggled with different thoughts, and so how often do you hear people say, I don't know why they're so depressed, they have everything.
Exactly.
We hear that a lot with the celebrities. People say they have so much money, they're so funny, everyone loves them. It does not discriminate. Depression, you find it in all different groups, all different backgrounds, and people just need to be able to listen and not diminish their feelings and say things like that, because it really hurts, and then they're not going to speak up.
Yeah.
Why am I going to tell my parents if they tell me, why are you crying? You have everything.
Yeah, exactly. Especially that tough love, like, why are you crying? And then you grow up with that attitude, and so as an adult, especially for men, I feel like you have to suppress those feelings because you were told not to cry when you fall and bump your knee, and not to cry when you're upset about something not being in its place, when that's just who you're predisposed to be as a person.
Yes.
And your parents need to support that. And bullying, I'm sure, is a huge factor in that as well.
Absolutely.
Especially with social media these days. So it's something as a parent, what can a parent do if you're sort of, teenagers will be teenagers, and they almost have like the same symptoms, if you will, of like you're a teenager just being a teenager.
For sure.
But what can I do as a parent if my child is showing these signs?
Encourage them to talk and letting them know that there's nothing to be ashamed of. Difficult feelings happen. So jealousy, shame, guilt, all the fear, all of those emotions are tough to deal with, but you have to be able to deal with them. Don't be ashamed of them.
Yeah.
If you're jealous, talk about it. Don't be ashamed and hold it all in, because then it eats you up and then it comes out a different way. If you're gonna cry, cry.
Yeah, I think crying is one of the biggest things too. And sometimes, it's good to do it alone, but sometimes it is nice to have a shoulder to lean on, whether they talk to you or give you advice or not. Just someone to hold you and tell you that you're gonna get through this and everything is gonna be okay, because life truly does go on. It's a roller coaster.
Yes.
You can't have the good without the bad.
Exactly, and that's why it helps to have a mental health professional or doctor that you can speak to about these situations, because there is no judgment. You need to talk to a professional to figure out what to do next. So as soon as there are signs of depression, seek help.
Absolutely, and not just for teenagers and children, but women experiencing postpartum depression, mothers, sisters, daughters, people that were veterans, doctors, anybody, because life takes its toll on you. It's absolutely natural. So real quick, before we go to another break, where can we find help? Obviously, if I have insurance, I can seek a professional to help me. What other outlets are there?
Yes, you can always go to one of the hospitals in town. If there's immediate danger, if there is somebody that you feel has the means and is about to carry it out, call 911. The police in the city know what to do and know where to take you for help. So I've had a lot of people who say, like, my boyfriend or my girlfriend is saying if I break up with them, they're going to kill themselves. If they
Put you in a position.
Yeah, and if they truly feel like this is something that's about to happen, call 911. They will help point you in the right direction. But any of the area hospitals, counselors, psychiatrists, even your primary care doctor.
Amazing. And up next, we'll be sharing some of the outlets for you guys to get help if you're struggling with those ideas. Thank you so much, Dr. Kate Rodriguez, for joining us as our mental health expert. We look forward to having you back. You're amazing. Up next, we're going to dig a little bit deeper into this difficult subject. As I mentioned earlier, we're going to provide you guys the hotline numbers, places you can get help, and a few more tips to keep you and your loved ones safe. We'll be right back.
You're watching Coastal Living on KZTV, the only lifestyle show made in the Coastal Bend for the Coastal Bend.
Don't go anywhere.
We'll be right back.